radiographer in operation theatre. First, support for imaging during surgery. Radiographer use imaging tools to assist surgeons during operations with special X-ray equipment known as image intensifier tool, like portable X-ray machines and C-arm fluoroscopy machines. These machines can take real-time pictures that help direct surgical procedures like spinal surgeries, orthopedic fracture fixations, and foreign body localizations. There are some cases that also requires imaging like general surgeons, neurosurgeons, and urology surgeons. Second, radiographer also need to preparing and maintaining equipment. Before surgery, radiographers test and prepare the imaging equipment to make sure it is in a good working order and positioned correctly without compromising the sterile field. They also help troubleshoot technical issues as soon as possible to prevent surgical delays. They are also in charge of cleaning and maintaining the apparatus. Third, safety from radiation. Ensuring radiation safety in the operating room is another duty of a radiographer. Leads aprons and thyroid shield are used as protective measures for patients and the surgical teams. And the ALARA, as low as reasonably achievable principle, is applied to reduce radiation exposure. Then, positioning and patient care. In order to ensure that the images are precise and appropriate for the surgical purpose, radiographer help patients position themselves correctly for imaging while preserving their comfort and safety. Other than that, cooperation within the team is important. As members of the multidisciplinary surgical team, radiographers need to collaborate closely with anesthetists, nurses, and surgeons. It requires confidence, technical skill, and the ability to work as team. To foresee imaging requirements, they must also familiar with the surgical techniques. After that, we go to image management and documentations. To guarantee that all paperwork and patient data are securely stored, radiologists must label and store images in the hospital's PACS, which is short form for Picture Archiving and Communication system after imaging. And lastly, ongoing education. Radiographer must continue their professional development to stay up to date with new surgical radiography techniques and imaging technologies. Becoming a radiographer also requires much effort, good attention to details, and the ability to help others feel at ease.
As radiographers, we work with many healthcare staff. We communicate with doctors, specialists, and radiologists to explain scan results and follow their instructions. We also work with surgeons for treatment planning and nurses who help prepare and transfer patients to the X-ray room. For point number 2, importance of communication is very important. It helps us to avoid mistakes, keep the patient safe and comfortable, and improve the accuracy of diagnosis. It also supports teamwork in the hospital. For point number 3, form of communication, we use verbal communication to give clear instruction to patient and share information with staff. Other than that, we use non-verbal communication such as gesture and body language. We also use written communication on through scan reports and the patient notes. For point number 4, challenges in communication. Sometimes communication can be difficult. This includes patients who cannot speak well, like children, language barriers, emergencies, and different knowledge level between staff. For point number 5, teamwork tips. Use simple and clear language. Use the read-back method to confirm information. Show respect and empathy, especially to anxious patients. Use technology like messaging system for quick and accurate communication.
I will be talking about best approaches for patient care in radiography. First, effective communication. A radiographer should clearly communicate with patients before, during, and after procedures. This includes explaining the procedure briefly but truthfully, addressing patient questions and concerns while providing instruction for preparation and positioning. Good communication helps reduce patient anxiety, build trust, and ensures cooperation throughout the imaging process, especially pediatric, geriatric, and patients with disabilities. Second is patient identification and safety. The radiographer should always confirm the patient's full name and ID number to avoid any error. This is to make sure the right patient receives the correct examination, improving both safety and more precise diagnosis. Next are about infection control. Radiographer must follow strict infection control procedures such as using sanitizer beforehand, cleaning equipment between patients, using personal protective equipment, and adherence to radiation dose guidelines. This is to prevent cross-contamination disease and maintain a safe and hygiene environment for both patients and radiographer. Then, we must also maintain patient privacy and dignity by ensuring that the patient is dressed properly and obtain consent before touching for positioning. Conversations about patients' condition should also be held discreetly to honor patients' privacy. Then, radiographer need to attending to patient comfort, minimize stress and physical discomfort. This can involve adjusting the table, providing blankets, or using positioning aids. A relaxed patient is more likely to stay still and ensuring better image quality. After completing the image procedure, what the radiographer should do is provide clear instruction on what the patient needs to do next, including waiting for results, follow-up steps, and precautions. Radiographer could also offer reassurance to the patient and record any details of the procedures. Lastly, showing empathy helps patients feel understood and cared for. Radiographer should be attentive to non-verbal cues and respond appropriately. A compassionate approach helps improve the overall patient experience and promotes a positive image of healthcare service, thus creating a supportive environment. That's all.
In this scene, we can see that the radiographer was preparing the tube and other equipment first. The radiographer asks the patient's full name and ID number for confirmation, then proceed to ask about LMP to avoid a potential pregnant patient. The radiographer introduced herself and explained the procedure truly to the patient, then asking the patient to change into hospital gown. The radiographer helped patient to wear shielding before the procedure. Radiographer also need to provide blanket so patient feel more comfortable and relaxed. The doctor communicate with the radiographer on which part that had injury and ask for clear image to diagnose the patient accurately. The radiographer asks for permission before touching the patient and continue with the procedure that begins with positioning.
Inhale. Okay, hold up. Okay, you can breathe out normally. Now our session is done. You can remove. You can change your
The radiographer asks the patient to change into her clothes bag. The radiographer asks the patient to wait for the results and consult with her doctor.